So first, let me thank you for the opportunity to present. I always get excited when I hear Dan speak as a native Detroiter and someone who was there when Detroit was, and then watch what it became. Whenever I hear the word tree canopy, because I grew up on a street that had a fabulous tree canopy, I watched all of those trees become diseased and all of them have to be cut down. And then I watched my mother and a group of community activists plant all of those trees back with the knowledge that they would not be around to see those tree canopies, but that those tree canopies would indeed return. So at least part of what I'm going to be talking about is that whole power of community to take these things from mind to action. And certainly there's no pressure when you say, Doc, that you want me to talk about how we're going to make this more of a public health thing. So ignore the slides for a minute because I'm going to start off by just talking about a statement that was made by NACHO, and that's the National Association of County and City Health Officials. And they made a statement a while back where they are recommending that federal, state, and local governments that we all adopt a health in all policies approach in the policy-making process in order to ensure that all policies made outside of the health sector have either a positive or a neutral impact on the determinants of health. And I think that when we first started talking about health in all policies, many people saw that as a way to keep progress from happening. You don't want to build this or you don't want to build that, and people became afraid of this concept of health in all policies. But truly, probably most of the people in this room realize that the biggest influence on health care is probably about 10% of the influence on health. Really, it's all of those other social determinants of health. And the things that we are talking about today impact social determinants of health, be it noise levels, be it things that isolate communities, whether they're walkable, whether they're not walkable. Do they isolate them from families? Do they isolate them from their place of worship? So policy decisions made outside of the health sector impact the determinants of health. And so that's where we want to have groups that are at the table who know health from a broad spectrum, not just the amount, the micrograms per deciliter of blood that causes lead poisoning, but also things like how do we work so that there are health impact assessments that are conducted prior or when many of these things are being considered so that we can inform people about how we can best have the best results come out of it. So the only thing that I would maybe challenge NACHO to say is that it should be a health department where health and all policies could come out of. And I see at least one head shaking, probably someone who worked in a health department before. Because many times, and I'm also from a health department, up until recently, that's where I spent my life, in a health department at the state, local, and then at the county level. So I've worked in them at all except for the federal level. And many times there are forces that can impede even local public health departments from saying and doing what's right around interventions that are being proposed. So not only local public health as a partner, but then also bringing in other partners. And this is where there is and I'm going to call it a movement because I don't get to say movement very often either. There is a movement in Michigan called the Michigan Power to Thrive. And what that is an alignment of two powerful disciplines, because public health certainly is a powerful discipline. When you think about it, we have the ability to do things like quarantine and isolate and shut down borders and declare health threats to others. So we're a powerful discipline. But also there's another powerful discipline, and that's called community organizing, the voice of the people. And many times we have not been at the same table, and when we are, we've been misunderstood. And Michigan Power to Thrive is trying to bring those disciplines together. And it's at an excellent time because of Detroit Future Cities. One of the things that I see when I read that document, and I actually have read that document, it's a fairly thick document though, but so I haven't taken it, I don't try to take it all in one chunk, I've taken it piece by piece. You know, there's that underline, there's health is kind of spread throughout, there's a thread that runs throughout, and it's implied. And so the next step, in our humble opinion, is to take it from the implied to the intentional. You know, intentionality is where we all need to be right now. You know we feel like it needs to happen. We say it should happen, but how do we get intentional about it happening? And that's one of the things that Michigan Power to Thrive will be looking at, which is a network of people who seek to align the resources of public health and the resources of community organizers. And so grassroots community organizers such as the ones that Dan has been talking about, bringing together business and industries. You know, it's folks who are healthy and well and able to ambulate, that get up, go to work, make our economy strong, who can take their mom and pop shops and bring them up to scale. So health is important, or at least should be important, to all of the players. So if all of that comes in, this is what it looks like from a statewide perspective, because it's not just going on in the city of Detroit. When Detroit pops up, you're going to see an acronym, MOSES, and please don't make me have to say what it stands for. But MOSES has pretty much taken the lead on the Detroit-Wayne County Power to Thrive. And truly, we are committed to the whole issue of, and it's Moses because many of them do come from a faith base. So you see there's a Jonah down there, and there's a Isaac there, and there's an Ezekiel there. And again, don't make me have to tell you what any of the acronyms stand for. But the Moses folks will certainly have a talk with me when I get back home, and I'll never forget it again. But along with Moses, there are public health professionals, not just public health departments, but a cadre of public health professionals that also includes the health department. Then there are also religious institutions, there are businesses, there are people who are dedicated to school, early education. All of us coming together to say, if we really want to see a change, if we really want to see Detroit's future become positive and bright, then we need to have health in all policies. And that's something that many of you have heard before as well. But here's some of the benefits of health in all policies. If you see here, not all of the communities across Michigan are dealing with the same thing. And so health in all policies really allows a rallying call for many around the state and even within the city of Detroit. You know, sometimes people become alienated if you're talking about a state as large as Michigan. And in Detroit, you may be talking about infant mortality, which may not be an issue in the UP. It may be more around immigration issues. Some other area, it may be more about minimum wage. For us in Detroit, in some areas, it may be about housing stock that's very old, lead contaminants. In another area, it may be infant mortality. Now, what does that have to do with Detroit Central Future Cities? One of the recent health impacts assessments that we conducted, we took a look at infant mortality in relationship to pay inequity by gender. So the fact that women get paid less, we looked at that and its health impact and the impact on infant mortality. So when we say health in all policies, we mean health in all policies. So as we start to look at economic growth in the city of Detroit, Are these jobs that are friendly to families? Are these jobs that are promoting and having pay equity? So truly health in all policies from beginning to end. Now, these are the 5 key elements that we propose that really promote health in all policies. One is everything that is being considered that it should promote health, it should promote equity, and it should promote sustainability. And as I looked through that document, I saw the words health, equity, and sustainability. But what we also have to have is intentionality. You know, it's there, but the next step, and the beautiful thing about this is that I believe, and Dan, correct me if I'm wrong, this is a living document. It wasn't written to be done. Now you're taking it to the next step. And so to have the intentionality around making sure that the things that come about out of this document are looked at through a health lens. Then we need to support the intersectoral collaboration, and we see that throughout this document, and we certainly see that in the work that we are doing. It can't just be public health, and it can't just be health systems, and I'm thinking Dr. Wisdom will support me on that. That when you talk about sick care, maybe you can think about just your doctor and the health department and hospitals, but when you talk about health and wellness, and creating health in all policies and creating a healthy community, because certainly by the time this document is implemented, my hope would be that Wayne County would no longer be ranking last in every health indicator that's done by the Robert Wood Johnson Foundation. If we are still ranking last in every health indicator done by that study, then we have some more work to do in terms of Detroit Future Cities. So we want to make sure that health in all policy and that there's a health lens. When we do this, we also benefit multiple stakeholders. A healthy, robust community gets out and votes. A healthy, robust community is more likely to be able to take jobs. People who are better educated also make, for the most part, and these are broad statements, people who have higher education tend to make better health decisions. All of these things promote a first-class city. We need to engage multiple stakeholders, and that was part of that process as well. But I will say to you, with this, this project called Michigan Power to Thrive, the difference here is going to be, it's going to be also grassroots stakeholders. You know, as I look around this room and most of the rooms that I'm in, you know, we bring about some pretty formidable people to the room. You know, it's PhD this and MD that and social worker that and Surgeon General this. So, but we want to bring together people who live and move and breathe in the community and can tell you if this is what we do in this community, this is what's likely to happen. This is the benefit that we're likely to have if this is done. This may not do very much for us. I remember we received as part of a grant from NACCHO to look at the effects of the demolition that was going on in the city of Detroit. Now, of course, in addition to making some recommendations around the use of water hoses and how demolition is done, we also walked the community and asked them what benefit was it having on you. And one of the things that a community member said, well, now with so many homes torn down, at least we can see the dogs when they're running towards us. Now, that's a huge health benefit. I know I'm hearing the groan in the room, but if you have, you know, lots of abandoned homes there and they harbor dogs that can be vicious, now with these homes torn down, one of the immediate benefits, and I say it's a health benefit, now we can see the dogs as they're running towards us. So there was a benefit there, and that's what happens when you engage stakeholders, and then you can say, well, what do we need to do now? Okay, that was good. That was a good first step. The other thing about health in all policies is that it creates structural or procedural change. We want long-term change. We don't want things that just started and then stops along the way. And that's done by policy and procedure. I'm learning every day that as much as I try to say, government can be minimized, government is when a mayor changes, when the governor changes, when a state rep changes, many things can change unless it's harder when it's structural, when it's procedural, and when it's in policy. So we're looking for that, a health agenda in all policy. I'll go through these values, but I won't go through them verbatim. I'm just going to go through the words that's there in red, talking about a just, equitable society, a decent quality of life for all, and respect for human dignity. Because what often happens when this type of revitalization is happening, people do worry about things like gentrification. That came up this morning. People worry about the fact that there's going to be green roofs in these neighborhoods, but there won't be in my neighborhood. So how do you get a conversation going through the health lens that says that the decisions that we are making, that they need to create a just and equitable society across the board. It needs to have respect for the quality of life and respect for human dignity. These are the threads that run across when you start thinking about health in all policies. On this one, the only word that I really want to point out is that looking for transformational remedies to social and political forces that undermine democracy, and hopefully no one gets scared at the word democracy. We're not talking about Democrat or Republican. We're talking about what we were founded on, and limit the power of people to achieve well-being. So again, when we look at health in all policies, looking at it through a health lens, and I'm a public health person, I'm a science person, but I'm also a social justice person because I've started too many programs and been involved in too many programs that start and stop and that sometimes don't have a strong health lens, certainly do not result in transformational remedies and that deal with social and political forces. I'm actually going to skip that one because I do want to talk about some of the tensions that occur when you look at health in all policies. And I'm only going to go to the third bullet, and that's agitation as a practice. And that is not something that public health always is most comfortable with. I think that that's where our roots started, but then I think that sometimes we're not the most comfortable with that agitation as a practice. And that's where bringing our strong community, grassroots community partners in. For us to be partners with the folks who put together Detroit Future Cities, but also for the grassroots community to also be a partner and to look at agitation as a practice. And again, being a longtime public health person, when they first said agitation as a practice, I got a little nervous myself. And then I came to understand that if we want things that are transformational, long-term, and sustainable, that it does take a certain level of boldness. I'm also going to skip that one. And I am going to just try to end with a quote by someone you probably already know, Dr. Ayton, the California Endowment Fund. As public health professionals, we need a new kind of practice where public health practitioners understand that creating health equity requires us to be in a deep relationship with people who understand and are willing to create and build power. Powerlessness is making us sick. So for us to have to be saying health in all policies, to be asking, demanding that things be looked at from a health lens will help to restore that power will help to restore that power, and will help to bring about what we want, vibrant communities that are also not just free from disease, but are also well. Thank you for your attention.
Thank you very much, Ms. Davis. And I'm just going to invite Dr. Wisdom to come up, but I'm going to lead off by the following assertion. When I was state health officer, I was very concerned about the high rate of hospital infections, people going to the hospital and acquiring illness. We brought in the big hospital systems and discovered they were perfectly content with the status quo. It was actually a 10 to 15% revenue stream if people got sick in the hospital. I know that sounds cynical, but I was the health officer and it was lots of meetings. We had a bill to no longer require motorcycle helmets. And I discovered there was a whole sector in the healthcare system that was perfectly happy to have people on donor cycles. And also had an episode where the tobacco industry was going to allocate all the anti-tobacco education funds, the tax money that we were getting from cigarette taxes, and have it go to physicians groups for medical care if in that way we could stop the anti-tobacco advertising in California. And all of a sudden, I was crosswise with the medical establishment who wasn't happy with me. And so I'm going to, I would think that the medical system would be our friends and our allies, but sometimes they've been a real challenge. Where'd Dr. Wisdom go? Is she behind me?
Your comment made her mad.
I'm sorry, Dr. Wisdom, really?
Not the first time.
Okay. So I think that the need to have the medical care system step up and come forward, and Kimberly Dawn is now at Henry Ford, and they're really the medical heart of the city of Detroit and needs to go forward with that. There's a lot going on. I think the health systems are stepping up. One big thing is under the Affordable Care Act, there's a lot more pressure to do community benefit. And so we're seeing, for example, Children's Hospital in Los Angeles, it sounds small, they're actually investing in the tree canopy in that part of Los Angeles. And you wouldn't immediately think that as a health intervention, but because they no longer can simply, Kimberly Dawn, please come up and join me. They can no longer simply say we're doing community benefit by taking care of indigents. They're now doing it in a much broader way. So welcome and thank you for being here.
Thank you.